there is some confusion between autism and the symptoms and the morbidities that occur in autism. And I want to start by giving you an example. Watch me. I coughed. I had a bout of cough, B-O-U-T, a string of cough. While I was coughing, at the end of my cough, I became short of breath. Sometimes, at the end of a long bout of cough, I may wheeze. While I was doing that, my chest was hurting. And at times, at the end of a bout of cough, I bring up phlegm. The phlegm looks bad. It looks almost like pus. And it has a streak of blood. It has a foul smell. Last night, I had a fever. For the last 10 nights, I've been waking up in the middle of the night with night sweats. And in the last 1 month, I lost 8 pounds of weight. And I'm not trying to lose weight. So, cough, bouts of cough, chest pain, shortness of breath, wheezing, fever, loss of weight, night sweat, they're all symptoms. What could be the diagnosis? The diagnosis could be bronchitis, pneumonia, bronchiectasis, it's a complex lung condition that produces terrible-looking sputum, streak of blood, tuberculosis. I'm an older man. It could be cancer. I'm losing weight. I have night sweats. Those are diagnoses. These are symptoms. I notice a lot of parents in this field that I encounter get confused between diagnosis and symptoms. Many of the symptoms of autism have taken on a life of their own, with words like fine motor coordination disorder, sensory integration disorder, auditory integration disorder, sleep delay, sleep disorder, expressive language disorder, hyperactivity, hypotonia, developmental delay, ADD, ADHD. No, they are all manifestations and symptoms of children with autism at a certain age. The younger child might have serious feeding difficulties. The older infant would have tremendous problems with constipation, serious difficulty with sleep. That's not a sleep disorder. That's very much part of autism. So I urge people not to get hung up, not to walk away from the doctor's office with a diagnosis of a symptom carried as a diagnosis. You must ask, why does my child not sleep? Every child should sleep. A 2.5-year-old should sleep 9-10 hours. This guy does not. You have to understand why not. So I have now noticed over the last 20 years, there is tremendous confusion with the way people read their material regarding all of these, what I call co-morbidities, or basically the symptoms of a very complex, biologically determined behavioral disorder called autism. Therefore, as you learn about autism for your own child, please ask question. Is it simply not a symptom? Should I kill myself trying to do the biomedical treatments, or should I spend all my resources on the treatment of the core problem in autism, which is it's a social communication disorder? How do I make my child a socially communicative being so he would have a life? So giving him antifungal therapy, antibacterial therapy, macrobiotic diet, multivitamin ingestion, secretin, horseback riding therapy, and these will not affect autism. Your knowledge, how to understand why he behaves in the manner he does, how you decontaminate those behaviors, how you handle his anxiety disorder and his mood dysfunction will make you a successful parent where you could take your child and graduate him from high school. He would still be autistic, but he's employable and he will have a life.